can we get a roll call, please? Sorry, let me go back one step. Let's get a vote for the approval of the agenda. If you make the motion or the second, please state who's making it.
Kara will move. Russ Devine.
Jeff May, second.
All right, we have a motion and a second. As we've done in the previous meetings, unless there's someone opposed, we'll consider it approved. Is there anyone that'd like to oppose the motion and second? If not, we'll consider approved. The agenda is approved. Now, Tracy, can I have you do a roll call?
Sorry, I had a hard time getting in. I got kicked off. John from Altoona.
Here.
Paul Moritz from City of Ankeny. Mark Mueller from City of Ankeny.
I'm here.
John Horton, City of Bondurant.
John is not here, but Maggie Murray is present.
Thank you, Maggie.
Yep.
Jeff Shug, City of Carlisle.
Present.
City of Clive, Jeff May.
Present.
City of Cumming, Anthony Belizzi. Dallas County, Murray McConnell. City of Des Moines, John Davis.
Present.
City of Des Moines, Michael Ludwig. City of Des Moines, Steve Neighbor.
Present.
Dart, Luis Montoya.
Present.
City of Elkhart, Dustin Teague. City of Grimes, Matt Arens.
Here.
City of Indianola, Charlie Dissel. City of Johnston, Dave Wilwarding.
Here.
Madison County, Tom Leaners.
Here.
City of Mitchellville, Wayne Patterson. City of Norwalk, Luke Paris.
Here.
City of Pleasant Hill, Madeline Strums.
Here.
City of Polk City, Chelsea Hoosman.
Here.
Polk County, Brett Vandaloon.
Present.
City of Urbandale, Dave McKay.
Here.
City of Van Meter, Joe Herman. Warren County, David Carroll. City of Waukee, Brad Dietz.
Here.
City of West Des Moines, Eric Peterson.
Present.
City of West Des Moines, Kara Tragresser.
Present.
City of Windsor Heights, Dalton Jacobus.
Here.
Des Moines Airport, Brian Belt. FHWA, Darla Hugaboom. Herda, Julia Castillo.
This is Brooke.
Hi, Brooke. Iowa DOT, Andy Lunan.
Hello.
Anyone else that I did not call? Okay, thank you.
Thanks, Tracy. Next, we'll move on for approval of the meeting minutes of the meeting from May 7.
This is David McKay, and the only correction I'd note is that I'm listed in the absence, and I was at the virtual meeting. So if you could change that, I'd make the motion to approve.
Thank you. I'll get that changed.
Sturms, I'll move approval with that change. Make the second, I guess. Sorry about that.
All right, we have a motion and a second. Is there any further discussion on the meeting minutes of May 7? If not, we'll consider those meeting minutes approved. The next item on the agenda is a presentation regarding from DART regarding the COVID-19 stimulus package. Luis.
Yes, good morning, everyone. I think we have a presentation. Yeah, we'll pull up. Wanted to give you an update on how DART has been responding during the pandemic. Partially so you guys could just kind of get an insight a little bit into kind of what we've been up to, but also so that maybe as a group, we can start to think about, how we move forward as a region, considering how people's travel patterns are changing and just in general, life is changing. So this is just a little overview of some of our response goals. And that has been, of course, first and foremost, to protect the health and safety of our employees, as well as the public. We wanted to always provide essential transportation throughout the pandemic. There were a few transit agencies out there that shut down entirely, that just couldn't, safely operate, and they did shut down. Most, though, the vast majority of transit agencies continued to operate throughout the pandemic, although, as we'll get into, saw some drastic changes in ridership, of course. We also wanted to think carefully about how we could keep moving smoothly and in terms of how people move about the community and thinking about those negative impacts to our riders and to the organization. Go ahead, Dylan. So one piece that I just want to note up front, because we do talk so much about funding, is just noting the federal funding that we did receive, and that has been a big help throughout this. We won't go through all the details. I'm happy to take any questions, although I'll admit I'm not necessarily the expert. But there was, of course, the large package that Congress passed that included $25 billion in funding just for transit, and that was distributed through formula funding, the way we receive our federal funds. And so that included 19 million, a little over 19 million for DART. And so that funding, thankfully, has been very flexible, and it has allowed us to do a lot of the things that I'm going to describe for you in terms of paying for enhanced cleaning, paying for hazard pay for operators, things like that. And so luckily that leaves DART in a decent position. Kind of the bottom line is that we're in a better position than a lot of other transit agencies who also rely on things like sales tax, which has been hit very hard over the past few months and will continue to be hit, whereas DART relies local funding on property taxes, which are a little bit more stable, or definitely more stable than sales tax. Next slide. So as I mentioned, we're definitely being mindful. $19 million can seem like a lot, and it is in terms of a one-time distribution. But we did incur significant costs throughout the response to the pandemic, and we imagine that we're going to continue to incur those costs. So as I'll get into, we're going to continue with enhanced cleaning, a lot of other expenses that we're incurring, and also we are anticipating, some sort of, longer term economic recovery that could end up impacting DART. And so we want to be mindful with how we use those funds. So a little bit more specifically about our response. Next slide. So very early on, as before even there was community spread in the region, we stepped up our sanitizing on board, started using kind of a aerosol spray every day in all our vehicles, also doing a full wipe down. It was funny, as I was looking at this presentation, this picture was taken in late March, when we were still telling people that masks weren't needed. And so it's kind of funny to see people, going about their business, let alone cleaning, without wearing masks, and just kind of reminds you of how much our learning has evolved throughout this. One of the other things we did pretty early on was to, and it was also in late March, was to suspend fare collection so that we could board everyone in the back of the bus. And so that was meant as a measure to limit exposure of our operators. And so we let people get on and off the back and that meant that they weren't going to pay. But then, of course, if people had the need to use a wheelchair or use the lift, we could still use the front door for that. We also put kind of a chain up, or a little more like a rope, to separate to keep people from coming up and getting too close and talking to the operator. That was a couple of early things that we did. We also tried to just put out the message that people should only be taking essential trips. One of the downsides to going fare free is that you get some people who are just looking for something to do, or maybe looking for some shelter over their head, that want to just ride the bus and will ride it around, until you ask them to get off. And so that was some challenge that we had. And so we, had to make sure that we were enforcing for people that, you can't just ride around circles on the bus. You got to be going somewhere. And, with a little bit of coaxing, we were able to get that mostly under control. We also increased the number of buses that we were providing on our busiest routes, because even though ridership, and I'll show you some ridership stats, even though ridership dropped, dramatically, that wasn't equal across all our routes. And so some of our busiest routes stayed pretty busy. And in order to keep the crowding down on the bus, we had to run additional buses on those routes. We also supplied PPE to our operators and encouraged our customers to wear masks, and staff. Next slide. More about how we've kept our staff safe. This was something that in particular was identified early as it was going to be a challenge, because if you think back to our goals of wanting to provide continued transportation service throughout the pandemic, our frontline staff were exposed. And I know a lot of us had the opportunity to work from home and limit our own exposure, but when you're a bus driver, your whole job is to be interacting with the public. And despite us trying to increase some social distancing and pass out PPE, we knew that we had to do more than that to try to help people feel safe for showing up to work. I mentioned increased sanitation and cleaning. We provided, sanitizing wipes, hand sanitizer to our operators as well. We also instituted well-being checks. Sorry, I'm not sure if there was a question. But we also instituted well-being checks so that whenever somebody shows up to work, there's a photo there, the upper right. They have to check in. They have to check in and get their temperature taken, and then answer some questions about how they're feeling. And so that's something we do for everybody that shows up to work at DART. Of course, we also did on-site testing, where we did have operators who got sick. We had they kind of trickled in here and there. You'd get 1 or 2 a week, and that didn't start until, I want to say, late April. Did we start getting cases of operators getting sick? Also mechanics, and so it wasn't quite clear that it was necessarily people. The mechanics weren't exposed to the public in their job, but they were still showing up to work and being exposed to people or being exposed in their regular lives. And so we wanted to take the step to test all our staff, and this was around the time I think that a lot of the meatpacking plants were having outbreaks, and we wanted to make sure that we got any infections in our own staff under control and identified and isolated. And so we did do that check in, sorry, I'm forgetting the dates. I want to say it was early May or so. And we did have a number of cases that resulted from that test, and a number of them were asymptomatic. And so we were really thankful that we were able to get everybody tested, and so that we can identify even those asymptomatic folks and get them under quarantine. Other things worth mentioning, I mentioned premium pay. That was something that our employees who are in collective bargaining units really pushed for, thinking about how they were being asked to put themselves at risk, put their families at risk, and that they wanted some additional remuneration. And that was something we were able to do because of the CARES Act funding. It wasn't a lot. It was a slight bump in pay, but then also kind of a promise of you work a certain amount of hours and you're gonna get a little bit of a bonus in PTO, and that was to get people to stick around and keep working. The other thing that we did was to update some of our leave policies and allow for leave of operators with existing health conditions that would put them in a high risk category. And so we had, I want to say about 25% of our operators take advantage of that. Another handful of operators who had to stay home with kids because the schools were closed, daycares were closed. They didn't have other options for taking care of their kids. And so we took some steps to have some leave policies in place to be able to keep them on staff, but yet give them the flexibility they need to take care of themselves and their families. Next slide. One of the things that that kind of came to light throughout this is kind of the way we tend to think about transit had evolved. So whereas, you know, traditionally we really gauge ourselves based on our success based on ridership, and we look a lot at our ridership stats and think about in particular how many people are riding relative to the amount of resources that we're spending, and we try to maximize that. But during the pandemic, we've really been concentrating on actually limiting rides by telling people only ride if you're going to work or going to the grocery store, or going to the pharmacy, essential trips only. By putting additional buses out on the street so that we can spread people out, make it less efficient of our service so that we can reinforce social distancing. And so there was an article that was published in City Lab that talked about how, you know, transit isn't necessarily, you know, competing for rides, as I mentioned, and nor is it just this kind of social service that is there only for, you know, the poorest of the poor who can't get around anywhere else. Because what we were seeing was, you know, people were going to work. These were the essential workers that, you know, everybody talks about needing to get out there. And, you know, maybe they weren't doctors, but they are people who, you know, get the food that we need, that support healthcare services, that do a lot of the other things to keep the rest of us going in our day-to-day lives. And so those were the essential workers, and those are the folks that are relying on DART. And we did get some of that feedback from our riders and from our general public. Yeah, you can go ahead and go forward, where people understood that you know, the risks that our operators were taking to continue to provide service, a lot of the extra steps that DART was taking in order to try to ensure the safety of our riders and our employees, and so we're very thankful for some of the thanks that we received around that. Right around late March and then really in mid-April, we had to reduce service. We did see ridership drop pretty dramatically early on, and then stay down, and we knew that it was appropriate for us to reduce our service. Also because we were offering those operator leaves, and so we just had less workforce to put service out on the street, and we wanted to concentrate our resources on the busiest routes. So we reduced service by 50%, was the lowest we got on April 12th to about late May. We were in that profile of 50% service reduction. You know, we had to suspend service on 5 routes. Those were routes that were already you know, fairly low ridership, that were only operating during certain times of the day. And so it made sense to suspend those routes first. And then we did reduce frequency on all our other routes though. Next slide. So here's a little bit more detail on the ridership. So you'll see all the way on the left is March. The purple and green is ridership this year, and the orange is ridership last year. So we were actually having a great couple first weeks of March. Purple and green are higher than orange, showing that we had ridership that was exceeding last year's ridership. We were feeling pretty good about things. And then of course, mid-March, we have the governor, I think that's probably when community spread happened. The governor issued restrictions on businesses, and we saw a pretty steep decline right away. And so I think it went down 45% at first, and then 50%, and then 65%, and it kind of bottomed out at about 65 or 70% down on the weekdays. You can see that was relatively steady. I don't have the latest data here, but we have started to see a little bit of an uptick since the restrictions were lifted. The last couple of weeks, we've seen like about a 5% increase week over week in ridership. So it is starting to inch back up. And as I'll talk about, we're starting to pick our service back up accordingly. This is paratransit ridership. So this is our ridership for, this is the door-to-door trips that we provide for people with disabilities and those needing additional assistance. Those trips have gone down and are staying down. It makes a lot of sense. A lot of these folks fall into high-risk health categories, and so they are safer at home and staying at home. Also, we serve a lot of meal sites for seniors, things that are sponsored by Polk County to get seniors out of the house and get them socializing. And those, of course, are closed during this time. And so we anticipate this part of our business staying low for a while. I mentioned some of the ways that we had to reduce service, but we still wanted to make sure that we were targeting service where it was still needed, and in particular, some of those employers that were still working, manufacturing, food distribution. Some of these things, the Whittem Group is an example that's listed there, where this is a group that has an unlimited access partnership with DART. They have many employees that get to work on DART, but when we reduce service, our bus times no longer match their shift times. And so we had to set up a special shuttle from DART Central Station to get people. They could still get to DART Central Station from, a lot of people transfer to get around. They could still get to DART Central Station, but then we had a special bus at a special time to take them out to the Whittem Group. And we also did that for the Hy-Vee commissary up in Ankeny, where, of course, these are, again, essential workers, need to get there, rely on the bus, and so we had to make sure that we were still providing service for those folks. We also expanded our partnership with Uber. I mentioned that we had to suspend service on a few routes, and but we didn't want those people to be just left without a way to get around. And so we already had a partnership with Uber around a pilot that we've been doing since October. We expanded that to cover more areas so that if people called in and said, hey, I live off Fleur Drive, the Route 8 was suspended, how can I get where I need to get? We were able to get them an Uber to at least get them to DART Central Station so that they could catch a bus to get where they needed to go. Go ahead. The other thing that we were doing is that we recognized that there were other needs in the community besides kind of mass transit needs. The American Cancer Society had actually been transporting a lot of their folks to medical, patients to medical appointments on Uber. And those patients didn't have as much confidence in that during these times. And they were hearing that all the steps that DART was taking to keep buses clean, test operators, distribute PPE, all those things. And so they started putting more of their patients on our paratransit vehicles so that we could provide that service to those folks. We're also working with DMARC to help distribute food, and working with Polk County Emergency Management to move people to shelters. I'm not sure how many of you are aware of how some of the people experiencing homelessness are being housed during this time to try to spread them out and ease the burden on shelters. But we've been helping with the transportation because we're able to, again, spread people out on the vehicle and get them where they need to go. One of the things that's been really challenging throughout the pandemic is that guidance has been slow and that it has evolved. And of course, the evolving guidance is totally understandable because our understanding of the way the virus spreads has changed, what we need to do to combat it, but then also kind of what the societal goals are have evolved from shelter in place to let's get businesses going again. Most recently, the CDC did come out with recommendations for transit. And so by the time those came out in, I want to say mid-May, just a couple of weeks ago, we were already doing all those things. You know, it was all the things that, enhanced cleaning, PPE, give people space on the bus. And so, we were thankful that those guidelines eventually came out, but, we had already been working with our peers across the country to kind of talk through best practices and implementing just about all of them. So I want to talk a little bit about where we go from here. One of the things to think about is that there's really stages in our management of COVID-19. So of course there was that kind of a crisis response stage where we were really focused on enhanced cleaning, putting some of those measures in place to get distance between our operators and our customers, distance between the customers and each other. Then once we got some of those things under control in late March and early April, We focused on kind of stabilizing, getting the right levels of service in place. That's when the CARES Act funding came in, and we were able to get some assurity around how we could manage ourselves fiscally through this crisis. And that's when we implemented some of the premium pay for our operators, and so that we could ensure that they would stick around and keep working for us, and stay healthy, so that we could provide the service that we need for our community. And now we're moving into the third stage, which is managed return, which I'll talk about in a little detail. And then we're starting to think about the later stages, which is how do we get back to full recovery, back to the full service levels, considering all the special precautions we still have to have in place. And even more than that, how do we think about resilience and think about how do we fundamentally transform our practices and our outlook, because we've so long kind of gauged ourselves on how many people we could pack on a bus. And that's no longer really the societal objective. Next slide. This is a slide that we borrowed to just kind of show our thinking as we go into this stage of managed return. The red bar being transit service and the purple lines being ridership. And this is just representative, but it's meant to show that we do expect ridership to go up. In fact, it has been going up these last couple of weeks. We don't know whether it's going to go up quickly or it's going to go up super slow. I shouldn't say quickly. It's probably not going to go up quickly. Whether it's going to go up slowly or super slowly, just given what we've heard from many of our partners in the community about how people are going to continue to work from home for a while. We know that people are going to continue to probably limit their trips, and that people have come to rely more on not traveling and staying at home. And so we're just naturally going to see ridership stay down for a while. We just don't know the degree. However, we do know that people can't get anywhere if they rely on transit, and that transit service just isn't there. And so from our point of view, you have to start increasing the service so that people can start taking advantage of it and taking advantage of things being open and getting out and moving about the community. Next slide. And so these are all the things that we're thinking about in terms of returning to service. I'm not going to go through all of them, but it's a lot of the same goals, and it's a lot of continuing what we've been doing. We have to continue the enhanced cleaning. We have to try to maintain social distancing on our bus. However, some of these things aren't going to be sustainable forever, like fare collection. We can't, fare collection accounts for about 20% of our revenue, and so we can't offer free rides forever. And so on July 1st, we are going to be implementing back the fare revenue, and that's because we've put a lot of those other measures in place to protect our operators. And so we feel like between people, more people are wearing masks now. We're also going to be passing out masks. Between all those things, we're doing the best we can to try to limit spread, but at the same time understanding that there's certain things that just have to happen, and we have to keep moving. Next slide. So that's all I had at this point. I want to see if there's any questions. Sorry, I don't have the chat feature open, but I don't think I saw anything come up through that.
All right, thanks, Luis. Appreciate the update. Moving on to the next item on the agenda is the report and vote for the draft federal fiscal year 2021 to 2024 Transportation Improvement Program. Shreyoshi?
Yes, thank you. Good morning, everyone. As you all know, the MPO staff has been working on the Transportation Improvement Program for the last few months, and we've been in touch with all the member communities, getting updates on their federally funded projects for the next 4 federal fiscal years. So I wanted to let you know that the draft document, including the list of federally funded projects, is up on the MPO website right now for review. That's the link to get to the web page up there, and it was also, I believe, included in your agenda packet. I would encourage all of you to take a look at it, especially the list of projects, and make sure that the projects from your community are correctly programmed. And if you see any errors or any changes or updates that need to be made, then please get in touch with me so that we can incorporate those into the final document. So with that, starting June 1st, we have entered a public comment period of 45 days. We'll be receiving feedback from agencies as well as the public. We also hope to do a public meeting online, of course, on June 24th. And that information will also be up on the MPO website for those that might be interested in joining or asking a question. The draft tip document is to be submitted to the DOT for review on June 15th. And following the public comment period, we'll be submitting the final doc, the DOT, on July 15, 2020. So with that, I'll be happy to answer any questions you might have at this time. Otherwise, we're seeking approval of the draft federal fiscal year 2021 through 2024 tip.
All right, are there any questions for Shriyoshi? If not, looking for a motion in a second.
Jeff May, so moved.
Dave McKay, second.
All right, we have a motion and a second. Is there any discussion or further questions? If not, we'll consider the motion approved. Thank you very much. Next up, we have a report on mobilizing tomorrow amendment. Zach.
Thank you. Following the approval of the long-range plan back in November, the executive committee had directed staff to develop an illustrative project list. Staff worked on that list, and the list was shared with the committees earlier this year. Staff has gone on to develop the actual appendix that will go into the long-range plan, and we have set a public comment period that will end on July 31st. The document was included in your agenda packet. It has a list of the roadway projects, illustrative roadway projects, as well as a list of illustrative bicycle and pedestrian type projects, as well as maps that include the locations of those projects. So staff, following that public comment period, it'll be a all online public comment period, but following that, staff will bring the amendment back for approval to the committees in August. If you have any questions about the appendix or the process, I'd be happy to take those questions at this time.
Any questions for Zach on the mobilizing tomorrow plan amendment? I guess, Zach, the one question or comment I had is regarding the memo was specifically to add the MLK extension. That's something that's been talked about for, we'll say, decades, and Polk County got quite a ways, and Des Moines got quite a ways into it maybe 15 years ago or so, and then ran into a roadblock of the federal government on the public land side. So I just, from our experience, we don't know that we're gonna be able to get past that, but I guess good luck.
Yeah, there's a lot of challenges, I think, with that project, but you're right, it was kind of the driver for developing the illustrative project list.
All right, if there's no other comments or questions on that, we'll move to the next item, which are upcoming events. Gunnar.
Good morning, everyone. Just a very quick note to let you know that we're not scheduling any more speaker series events for the near future. If we do, we'll likely continue to be online. I did want to say thank you to all the people who attended the online version of the speaker series with Greg Schill earlier, or I guess last month now. He was a very great speaker, I thought, and we got a lot of really positive feedback on it. I'm going to sign off here, but I'm going to put in the chat box the link to the web video that we did publish on the Speaker Series site. So if you or any of your colleagues want to see his talk again, it is available for you to do so. So that's it for me.
Gunnar, could you maybe email that out or have that that link?
Yeah, I'll put it in the chat now, and then we'll also follow up in email as well.
Thank you. All right, are there any other non-action items of interest to the committee?
Yeah, I have one, Brett, just real quick. This is Todd Ashby. We sent out with the packet reminder the other day a document that said an excess STBG fund policy. That was something that exec committee had asked us to develop. They're going to be reviewing it next week. We've shared it with the STBG subfunding committee. Just wanted you, the tech committee, to have a look at it and be able to review it, offer any comment. Essentially, as if the MPO has any excess STBG funds, whether project doesn't use all its funds or more funding becomes available through the feds, what triggers asking communities for projects, kind of what that process would look like. So if anybody has any comments, we'd appreciate receiving them before end of day Tuesday anyway of next week, just so we could get them to exec the following day. Thanks.
Thanks, Todd. Any other non-action items of interest to the committee?
This is Dylan, and Todd might have more information on this too, but just in the last day or so, the House released the next transportation bill. Their version of the next transportation bill hasn't been approved or anything like that, and it's pretty fresh, but there's information coming out, and we can send that off to the committee, the details that we've seen, so you can review that. And if you want to take any action to reach out to your legislators or congressional members and so forth, you can do that. But we'll send more information in the same email that Gunnar sends the Tomorrow Plan link with.
All right, thanks, Dylan. Anything else? If there's not anything else, our next meeting date is July 2nd at 9:30. Assume that it will be a Zoom or GoToMeeting again as well. And with that, we are adjourned. Thank you, everyone.
Thanks, Brett. Thanks, everybody.
Dylan, I've got that email drafted if you want to ship that over to me.
Will do.
I forget, what are you sending me? Just a link?
Yeah.
Sounds
I'll
good.
send it over. Yep.